Um, Good afternoon, everybody. Good evening, and welcome to the March Google Hangout for Health to Dublin. We're delighted to have Dr. Tanya Mulcahy, manager of the Health Innovation Hub in Cork, to share her experiences and thoughts on innovating in healthcare.
Thanks, Richie, and thanks to everybody for inviting me to this hangout. I'm delighted to be able to give you some of the insights that I have, I suppose, on a personal level, but also from my experiences in the Health Innovation Hub, and also tell you a little bit about the future of what will be called Health Innovation Hub Ireland and how people can engage and participate in that as we go forward. So feel free to send in any questions. I think Richie's moderating the questions at that end, and if you don't have questions that you don't get to ask today, feel free to contact me afterwards or send them in through Richie and the team up there.
Great stuff, Tanya. I mean, obviously I introduced you as the manager of the Health Innovation Hub, but you've got quite a bit of experience with international companies and startup experience. You might just give us a flavor of that first.
Yeah, I suppose if I go back to the good old days, I did an undergraduate in biochemistry, but I did research and postdoctoral research in genetics, actually. And at that time, there was a huge amount of activity in the area of genetic diagnosis and genotyping and SNP analysis and disease detection. And I suppose I got this kind of, and probably a lot of the people who are part of Health 2.0 in Dublin and across the world, I had this kind of feeling that you could do all the research at the lab level, but it had to impact and there had to be an outcome from it. So I basically said, I'm going to America. And in my head, I wanted to work in a large multinational because I felt that's where it would be at. And I worked with Shearing Plough, who a lot of people would know about because they've had a strong presence in Ireland. And I worked with them for quite a while, and I was fortunate enough to be able to work in each division of the company for a while. And after that, then I suppose the lesson I learned from working in that is that in a large multinational company, things are very organized. It's process, SOPs, everybody has a clear role and there's no overlap between roles really. I suppose what that taught me is that I wanted to be in something where I had a more dynamic role, and maybe it's just that I'm nosy, but I wanted to have my fingers in every kind of part of the activity. So I started then with a biotech startup company. It was called Orchid Biosciences. They were doing what was really cool at the time, which was sort of DNA on chip analysis. You could go from when I was in the lab analyzing, maybe 5 DNA samples a day to hundreds of thousands in minutes. And it was really exciting, and it was a really good place to work. Started off with very few people, and then moved on to employing a huge number of people. So I think maybe if I leave it at that, and then you can come back and ask me a few more questions about it if you want to, in terms of lessons learned and that, I can tell you.
Absolutely, Tanya. Many thanks for that kickoff. Just to remind everybody, any questions or comments we can take through our Twitter feed at Health2Dublin, no particular hashtag, just to make it nice and simple, or else on our meetup page. Let's just return to that kind of background, Tanya, in terms of large international companies and all the way through to startup companies. Yeah. If you were to pick out 2 or 3 valuable lessons learned, what would they be?
I suppose, the valuable lesson for me was that, in a large multinational, everything is very organized, and the product pipeline you've a clear role in delivering on the product pipeline, and there's a huge amount of money put into developing new product pipelines. But I think if you're the type of person who has that entrepreneurial spirit and wants to be, really make an impact, the lesson learned for me was that being in a startup, there's no better place to be, really. I suppose it isn't easy, but it was really exciting. And when I went into that startup biotech company, it was the very early stages. They had one product, and in fact, the product hadn't even been fully developed at the time. It was just a concept. It was developed while I was there. And although I went in as an R&D scientist, I then had a role in everything from manufacturing to training the staff on how to use the products, writing manuals, storage conditions, you name it, we were doing it. And there were very few of us doing it at the time. But it very quickly, and I suppose this is another lesson learned, it very quickly went from one product to let's try and develop 5 or 6 products. And I think that was a mistake. And I suppose ultimately that company sold the IP rather than the products. It sold the IP to a larger company. So I suppose the lesson learned, I would say, in a startup scenario is to focus on one good product before jumping ahead to develop multiple products in the space. But the other lesson is it's a fantastic place to work in. Any startup is a fantastic place to work in, and irrespective of the outcomes of that startup, the lessons and the experiences is second to none.
Good. Thank you very much for that. Just interesting with that kind of international large company versus startup.
Yeah.
Are you seeing international companies trying to get a startup culture going within their own organizations?
Yeah, I mean, it's amazing. I don't know if any of you have come down even to the hub that's behind me here. You can't see all what it's like, but there are plenty of places like this in Dublin as well and all over the world. But there's a sense when people from multinational companies come and see this, they go, wow, we should do this in our own company. We want people to start talking and be more creative than, I suppose, when I was in a multinational, it was very regimented. If you were in one particular area, you stayed in that area and you didn't kind of communicate with other parts of the company because you had one job to do and you followed the SOPs or the processes. We find now that large companies are coming into us, particularly the pharmaceutical companies, because we're in the health space, to find out what's going on in the health space, but also to try and encourage, I suppose, innovative thinking within their own people. And I think there's a huge movement to ensure that people who have some good blue skies ideas might be able to bring them to fruition within a big multinational. So things are changing and it's a good thing. Good.
Yes, I certainly echo that. So then you moved into the management role in the Health Innovation Hub in Cork. And I guess, what was the main driver for that?
Yeah, I suppose if I step back, when I came back to Ireland from the US, I knew I love science and I love research and the application of research in the real world. I worked with Science Foundation Ireland for a little while, so that gave me an insight into a lot of the activities that were going on, I suppose, at the basic research level. But again, I really wanted to, there's that kind of, I think it's in everyone's blood, this idea that you want to, basic research is one thing, but applying that so that you have outcomes that can impact people, or, profit is something that's important too, or really have an impact, rather than staying in a journal publication or staying in a lab. I wanted to be able to have a role in bringing an idea or concept and making an impact through commercialization. So I started, I was in a management role in research here in UCC actually for a while. And then the Health Innovation Hub pilot was announced, and I suppose I was very excited by it and said, okay, that's where I want to be. So wasn't an easy process. There was an interview and all that. I didn't just sail into it, but it was a very exciting time. And so I've been working in the Health Innovation Hub for the last, I think it's almost 4 years now at this point, 3.5. So I think really what drew me to it is this idea that Ireland is in a really good position now. There's a huge amount of momentum in terms of good ideas, we have great education system, good ideas. There's supports there for people to bring their ideas into products, and the health space is just crying out for it. So so here I am.
Very good, and all the better for it. And obviously it's something we'll return to. We obviously have Health 2 Dublin, but we've got Health 2 Cork and Health 2 Galway, which certainly helps to make Ireland quite a vibrant environment for health innovation. But with that move in terms of into the management role in the Health Innovation Hub, and you're there kind of fostering innovation and helping startups, it's a different type of perspective. What were the valuable lessons learned? In particular, I'm thinking for someone listening into this around the do's and don'ts, really, when engaging with an innovation hub or when trying to get started, maybe with the first early adopter or whatever.
Yeah, I suppose, even for me, going through this process and engaging with Irish companies was an eye-opener, and also engaging with the health system. I mean, the Irish health system, I don't mean this in a negative way, but it is a big beast, really. And some of the infrastructure there is not easy to navigate. So I think having something like the Health Innovation Hub as a neutral entity has been a really good thing, because we can contact clinical locations, clinical teams, consultants, nurses, whoever it is, primary care physicians, without a vested interest in a company. And I think that makes it easy for us to say, look, this product or this company has been selected through the Health Innovation Hub, and we'd like to see if you could support the activities that they need to do. Us being a neutral entity means that they don't see us as having a real financial benefit or any other conflict of interest. So they're more inclined to listen to us, I think, in that sense. I think it's very hard for startups to get into the healthcare system. I think it's often very difficult to know even who to talk to within a system. So we're there to do that. But just in terms of a couple of lessons learned, I would say is that the one thing I noticed between companies in Ireland, be that startups or even larger companies, and in the US when I was working in the startup company, in the US, the customer is always first, absolutely always first. And whether that's a tester, a user, a potential customer in the future, they would fall over themselves to do what the potential customer wanted. I find in Ireland a little bit that there's an expectation that if it's a potential customer will support them and do their development activities. And I think we need to to revisit the way we, I suppose, where we put our customers in terms, or our potential customers in terms of providing for them. I'm not sure if I'm making myself clear, but I just think if anyone's been to the US, the customer is always first. And the priority is to ensure that we deliver for those customers. I don't see that as being a huge priority here. It's more a matter of getting the startup off the ground. And I think maybe a little bit of just potential customer relationship management would be a good thing.
I mean, just let's stay with that for a minute. I mean, if you look at the lean startup philosophy and the importance of understanding the problem you're focused on.
Absolutely.
Is that part of it, that to really understand that problem and to sort of to say, is this a solution for your problem, as opposed to here's a lovely solution, would you be interested in it? Yeah,
and Irish people are a unique type of people as well. They love being involved in something at the start or even through the process. And the worst thing you could do to someone is say, I've got a solution for your problem, if you haven't asked them what the problem is in the first place. So the Irish people tend to say, well, I don't have a problem. What are you talking about? And I think we need to navigate that very carefully. So as you said there, Richie, finding out what are the particular nuances of their problem will go a long way to engaging them as future customers.
Yeah. Just speaking from my own experience, some of the most valuable advice I got was, as you start out into the healthcare area, emotion can cloud your judgment. If you're working with people with diabetes, older people, people with mental illness needs, whatever, you kind of forget about the cash flow and the business model. Do you find that's a challenge, basically, that people kind of get consumed with the free pilot?
So are you saying that people want you to give them the product for free, basically, is it?
I think that's one aspect of it. And I think also there's the other side of it, in the enthusiasm to get in there and get started. People say, well, we have a customer, but in the real sense, is it a customer?
Yeah. I mean, I think that's something you have to be very careful of. Again, in the Irish situation is we tend not to address the elephant in the room a lot of the time. So you might say, well, look, we'll let you use this for 6 weeks on a trial basis, but you have to upfront identify when that's going to end and when people are going to start paying for it. We often encounter, when we go out to clinical settings with projects, we often encounter the teams or the clinicians saying, well, we have to put the patient first, which is absolutely right. And then it's very difficult to get a little bit of time to work with them to ensure that they can feed back to you as a company. So you have to get the balance right up front. But I do think setting the expectations at the very beginning are very important. And you probably will be of benefit to you, but also to the customer or the healthcare provider, to have those expectations laid out up front, even if it is going to be a trial or a free trial or you feedback on it. You need to set an endpoint, and you as a company need to let them know that you need to make profit.
Yeah, I mean, just interesting, kind of staying with this for a minute. I think, is the clinician the customer, or is the chief executive the customer, or the chief financial officer the customer?
That's a really good question, and it's a question I have still not been able to answer. And I suppose it depends on the situation. Clinicians can, within units, they have budgets to get certain products, but everything is within the procurement regulations. But then if you look at the chief executive, the CEOs of the hospitals and the hospital management, they have priorities that they need to address as well. So I think, I mean, they're all your customers, but I think as a startup, you need to go in at all levels. I think startups with good innovative products need to go in at all levels within a hospital. So you go in at the CEO level, you also go in at the clinician level, but you also come in at the nurses, whether if your product affects, porters, ambulance staff, whatever it is within the hospital that your product will touch, you need to engage with all of them. And we find that when we're running pilots for companies, communication at the outset is key to the success. If we go in and we just talk to the consultant, really, when you think about consultants are fantastic. They have the vision, they have they'll set you on the right path immediately, and they'll say, yes, we want this for our patients. It's a fantastic product, let's do it. But the people doing the work on the ground are usually the nursing team. And you have to engage with all people within the pathway, I think, at that point.
Yeah. And just to go back to a point that you made earlier on, obviously from a pilot, a live deployment, it really does need to be structured.
Yeah.
And does the healthcare organization look to the startup to apply that, or do they have their own rules?
Well, within when we're working on projects, we put together a project plan, and all sides have to sign off on it. So everyone knows their deliverables and the time frame for the project at the beginning. I would recommend even companies who are doing trials or pilots without the Health Innovation Hub's involvement to really make sure that you actually, at the very outset, document how it's going to work, the process is going to work, and get everyone to sign off on it.
Very good. Is it one of the challenges that when you go to clinicians and nurses and physiotherapists and GPs, etc., the time commitment that's needed? Is there a heads up needed there really to have a successful live deployment?
Yeah, so I do find, the people who work in the health system in Ireland are fantastic. They'll say yes to almost everything, and it's great that the enthusiasm is there. But they say yes to almost everything, and they also say yes to a really, really busy work schedule where they have, where patients come first and they are run off their feet. So again, it's mapping out the expectation of time, as you say there, and upfront seeing if they have the ability to commit to that. What I found is that something that you would do in 4 weeks' time, if you had all the time in the world to do it, is spread out, over months, because they only have an hour or so a day, or maybe 10 minutes or so a day to give to the project. So sometimes it's worth investing in a coordinator to go and sit on site and actually make sure that the activity is performed. Other times, as part of your planning, you have to realize that the team that are going to be doing the work at the clinical location can only commit a certain amount of time each day or maybe each week. And that means your project is going to be drawn out a bit longer. Okay,
just for those who are late joining, we're here with Dr. Tanya Mulcahy from Health Innovation Hub. Anybody has any questions or comments, please post on the Health to Dublin meetup page, or on just tweet us directly, basically, and I'll pick those up. I guess the other thing, just covering that, continuing that theme in terms of the initial live deployments and pilots,
yeah.
Is there something we can borrow from the UK, particularly NHS England, where they've identified a number of what they call vanguard sites, vanguard health trusts, that have basically been given the support to be innovative? Because yeah. I guess I'll build in another aspect to it and then open it up to you.
Yeah.
Is there a need to be a little bit more adventurous? Because sometimes pilots and live deployments can tell you things not to do as well as what to do. So I guess there's that aspect of the Vanguard sites, and then just that openness to learn and to fail, I guess, for want of a better word.
Yeah, and I suppose there's kind of a lot of aspects to that, to your point, but I would love to see a couple of hospitals around the country or primary care centres. And in fact, we do have people engaging that, but I'd love Ireland to identify, champions of innovation within the hospitals, and then identify hospitals that are classed as, innovation champions, and that they open their doors to innovation rather than looking at the technology and sort of saying, oh, how is this going to fit with procurement? How is this going to fit into our daily work schedule? How is this going to fit into our IT infrastructure? I'd like a hospital to embrace it. And that would come from a CEO saying, we're embracing innovation, and look, any company that comes to us, we'd hope to be able to implement it if it passes, the initial assessment phase, and really, I suppose, do as much as we can to embrace innovation. But when I talk about what we're going to do in Health Innovation Hub Ireland, we're trying to address some of those issues in our future activities. So I'll come to that in a little while.
Great, that's excellent. I'll just make a reference. If at any stage you want to refer to one or two case studies of companies that have come through the Health Innovation Hub, by way of background to any of the discussion, please do so. Okay. So obviously we've been talking an awful lot in terms of healthcare. Are you starting to see this idea of integrated care, where health and social care and even support services is really now the new kind of delivery or care model?
Yeah, I mean, I suppose there's a lot of talk about it, and I think particularly, the healthy aging, the smart aging agenda, the fact that the population is going to live longer, and that there's such a resource strain on our emergency departments and our hospitals. I think Ireland and the world is going to change the way we do healthcare, and keeping people out of hospitals, keeping families involved with patients at home while they're at work, just preparing patients for the onset of a chronic illness. I think there's going to be a huge step change in the way healthcare is delivered in the future. I think we're a little bit away from it, but it would be fantastic to see Ireland as the test bed and the location where these new methods of healthcare are employed.
Yeah, I mean, certainly just from my own experience in care of the older community, a number of countries are talking about integrated care and making steps, but the change management that's involved, the organizational change, is really something else. But let's turn the focus a little. So we've talked a lot about healthcare professionals and the time pressures and workload measures that are in those.
Yep.
If you were sitting down with a startup who was starting to engage, what's the one or two things you'd say to them to get the most out of the pilot, to help, if you like, organize it, structure it, deliver it, so that, at the end of the day, it has a better chance of working well and hopefully validating a business case? Yeah.
So, I mean, I find having a clinical champion is someone who is excited about the product and who actually has a need that addresses. I think that's a really good, I think every startup should look to have some sort of a clinical champion supporting their activities, whether it's an advisor or it is someone who's going to do the test, but you need to make sure you have the right person. You don't want someone who's saying, yeah, I like the idea, and then I can't see where it would fit into my organization. You need someone who's really excited about it and who wants to give their time to make sure that this works, because they can see the benefit for the patients, they can see the benefit for themselves, they can see the benefit for the organization. So having someone with the know-how and the knowledge and the insight into the system is very important. I do think, and I keep saying that as well, addressing the elephant, and so when you have a new product and you're in a startup, you won't know everything. And especially navigating the healthcare system, there are going to be big question marks in the process. How does this integration to an existing system? I can't get data in Ireland on the disease that I'm looking at because it's not there. We can't get pricing, whatever it is that's not available. You need to identify those up front and try and get that information if you can, or link into resources within Ireland that can provide you with that information. So, I mean, Health Innovation Hub is just one, but there are multiple resources and supports throughout Ireland that can help in that sense. And the point I'm trying to make is to don't avoid addressing those problems, identify the gaps at the very beginning and try and find the knowledge to fit into that. Because what happens is, like if we take for an example, integration into an IT system, your product might function very well on its own. But once you get into a busy hospital where IT is really overstretched, if you come across problem after problem after problem in terms of integration into an IT system, they're going to switch off. They're not going to want to engage because it is too problematic. So address those issues up front and make sure you have a good handle on them. Yeah,
interesting. If we look abroad, whether it's the UK, Denmark, Germany, America, Canada, are there any lessons we can learn there in terms of fostering innovation?
Yeah, I suppose, you know, the funding is a huge issue. We have good funding in Ireland through Enterprise Ireland and the likes, but if you compare, say, a health innovation hub here versus a health innovation hub in Canada, the funding and resources don't even compare. And I suppose you can even say similarly, if you look at the budget for IT in healthcare in Ireland, it's very small compared to other comparable countries. So funding is one thing. You know, I suppose I'd love to see a system where staff within the healthcare system could have time or leave to actually involve and engage in innovative processes, whether it's supporting a company, advising a company, or even just developing their own ideas. I think one of the big problems we have is that people don't have the time to look at new technologies because they're so caught up in their day-to-day activities.
Mm-hmm. Yeah, it's interesting, just back to what you were saying about the clinical sponsor and getting the excitement and also that involvement from health and social care staff. There were points that Richard Corbridge covered when he spoke to us last November. And it's an interesting, so you have, for example, I think it's Code for Health in America and possibly the UK,
yeah,
where NHS England actively foster or encourage staff to not necessarily get coding, but get thinking about innovation. Yeah,
and I'll come back to that again in when I'm talking about the Health Innovation Hub Ireland. There are activities in there that we're going to be delivering to try and stimulate an innovation and culture within the healthcare system.
Good. Let's talk a little bit about terminology, or more properly, maybe jargon.
Yeah.
I mean, you know, when I started in terms of healthcare startup with Assess Patients, it was about healthcare, and then there's health and social care, then there's health and wellness, there's digital health, there's connected health, there's, you know, and numerous other terms.
Yeah.
Is that a problem for startups in terms of, are they maybe trying to pitch themselves in a particular sector that is not making sense with potential customers, or is it a helpful?
I think, you know, I mean, I couldn't even give you a definition for all of those things if you asked me to. You know, I kind of brand them all under the connected but I think fundamentally for a startup, if the first thing you have when you're presenting your technology is this is the problem that we address, I think you're a long way along the road to being successful. If you can't really find the problem, but you can find a product that fits into one of those name boxes, I'm not sure that, I think you really need to start at what's the problem that we're addressing here, and is it really a problem? And then you can call it whatever you want in terms of a solution. But, you know, I don't know what you think, Richie, or any of the listeners out there think, but, you know, there are a lot of different terms out there, and we'll probably make up a lot more terms in the next few years. But ultimately, they're all somewhat connected and mean the same thing in a way.
Yeah, no, I from my personal experience, I think you have to start with the practical kind of person-based scenario, whether it's an older person, someone with diabetes, or a troubled past, or depression, or whatever, and then kind of paint through. It's like what you were saying earlier on. Listen, you've referred a few times to the future plans for the Health Innovation Hub. So why don't we turn to that? And I think you may have a presentation that you just want to broadcast as well. So please do.
Okay, so I'm going to try and share my screen with you, which I think I should be able to do. Let me see. Just going to open that presentation. So give me 1 second.
Yeah, just while you're getting ready there, for everybody, basically what's starting to happen is that the Health Innovation Hub Cork is really going to become the National Health Innovation Hub, which is quite exciting. And once Tanya has the presentation ready, she'll go through, and there's a number of different member organizations or component organizations within that, drawn from academia. There we go. I think we can see that.
Okay, so you can see that, can you?
Yeah, absolutely. Go ahead.
Now, I'm not going to go through all the text in this. I'm going to go through pretty quickly, but just to give you some background, I suppose the Health Innovation Hub started as a pilot, and it started in 2012. EI was basically the one pushing it, but it came about under the Action Plan for Jobs 2012, where they put in this disruptive reform to create a health innovation hub that would support companies and stimulate innovation in healthcare. It was very much set up on there was no budget, there were no staff, and they put in an interim director at the time, and the UCC, there was space in UCC to set it up, and that's basically what happened. So the Action Plan for Jobs was the driver for this. And at the time, when there was no staff here, Enterprise Ireland issued a call to their own Enterprise Ireland client companies, and 21 applications were submitted and 6 were chosen. So I've just named the 6 of them up there. I suppose one of them that's of interest would be Helix Health, because it's part of the e-prescription process. So a pilot was run with GP practices in the Cork area, and the outcome of that was reported back up to a national oversight group. And but at the moment, if you're a pharmacist, you will have received the e-prescribe email asking you to join the system. So basically, patients can now actually use the e-prescription process to, if they're at the GP practice, the prescription will be issued electronically, and they can then go to their pharmacy to pick it up. Currently, the prescription is still the legal document, so you have to turn up at your pharmacy with that document. But there were a lot of lessons learned in that process, and we're currently doing a second trial at the moment in the Mallow area with a different software provider, but also doing an e-prescription pilot. And all the information gathered from that will feed into the Office of the CIO and the activities under the e-health strategy. So, you know, there are good outcomes from these, and they will all impact how Ireland progresses in the future. But in 2014 then, when there were staff in place, me one of them, we issued an open call and a focused call. And so the focus call is very important because we liaised with the hospital CEOs in a number of locations and asked them what their number one problem was. And they identified infection control and hygiene management as their biggest issue. So we issued a call looking for solutions to address infection control and hygiene management. So we got 28 applications to the open call and 11 to the focus call. We went through an expert panel review process, and we selected 15 from the open call and 4 working together under the focus call. So just to give you a flavor of some of the types of technologies at the time, I suppose the biggest is really I use the terminology e-health very broadly, but anything that had an electronic health element to it. So that was almost 50% of the applications. So it does show you how important the whole area of e-health is. I mean, patient education at 10% was quite significant as well. And I think there's a movement away from, just providing patients with verbal information. They only retain very little of that. So providing a more interactive way for patients to be informed is becoming very popular, I think. So I'm not going to go through all these companies, but that's just a snapshot of some of the companies we worked with at that time. I told you there about the Helix Health, and the McLernan's is the other company that we're doing the electronic prescription pilot with. I'll just give you another example. In Silico is a company that have developed a platform for managing multidisciplinary team meetings within hospitals, and have allowed the hospitals that we've piloted this in to go from doing all their MDT management on paper, where the coordinator then goes back to our office and collates everything into one single form, and then circulates copies of that to everybody, to a system where it's done electronically and in real time, and can be tracked, and patients can be tracked and followed through the system.
Fantastic. Fantastic. I just want to go back to something you mentioned earlier. In the context of the National Health Innovation Hub, is there going to be a greater capability for health and social care people to get involved in innovation themselves? Is there going to be some sort of facilitated?
Yeah. So I'll if I go to what we're going to do. So we've recently been announced as that we'll be hosting Health Innovation Hub Ireland. So an independent review identified that the activities in the pilot should be expanded to the national level, and that it would be very good for companies and it would be very good for Ireland and for Ireland's health to do this. So Health Innovation Hub Ireland has almost been established. We're active, but it's not officially up and running yet. But we've expanded beyond just our little unit down here in Cork. So we've engaged with NUI Galway and Trinity College in Dublin. And with that, they bring expertise that will be very important to us. And in Cork, then it's UCC and CIT. But if you can see on that diagram, I know it's very busy, but with each of those locations, we have the hospital groups linked into those academic institutions. That provides a huge opportunity for us to identify clinical teams to support activities. And not only that, but it also feeds out then into the community care centres, the primary care centres associated with those areas.
Sorry, Tanya, I'm just going to cross over you there. We're still looking at the cover slide, so I don't know if you want to move to the second slide there, if that's what it is.
What are you looking at?
Just your cover slide, Health Innovation Hub pilot, the first one.
I've gone through a lot more, so you haven't. Have you seen any of the slides?
No, I haven't seen any of them. Sorry, I wasn't sure. Sorry, I didn't want to interrupt you because you were in full flow there. But what we can do is we can post a copy of the slide deck on the Meetup site, if that's okay. Whatever you want to do. I guess one question with the move to the National Health Innovation Hub, will there be a channel to contribute to maybe a government e-health policy? And by that I mean, if I look to Scotland, they have a very interesting e-health policy where they define certain areas where they will go to larger companies for solutions, things like electronic health records, etc. But then they also define other areas as being distinct, which needs involvement for startups and SMEs to foster innovation.
Yeah, so I unfortunately you're not seeing the slides there, but the Health Innovation of Ireland is going to have 3 activities. So we're going to continue to do what we're doing, which is taking innovation developed by companies and assist those companies to bring them into the healthcare system, to trial and pilot them, and develop them further if they need to. The second aspect is what we're calling innovation out. So it's taking innovation out of the healthcare system. If a clinician has seen a particular problem and has a basic idea that things can address that, we'll work with either companies or researchers or anybody that we can find to try and make that concept or idea a reality, so that technology can then be developed because of the clinical need identified and the basic concept being addressed by the clinician or the nurse or whoever it is. And then thirdly, we're going to be addressing that whole issue of innovation culture, which is to try and, not educate, but to bring in programs into the healthcare system where people will learn about the innovation process, what it means to bring a concept all the way from basic idea all the way to commercial product, and how they can engage in it. And by doing that, we hope to enlist what we're going to be calling innovation champions within the healthcare system. So from a company perspective, I would hope and envisage that in the future, companies will be able to go to clinical locations and say, look, can I talk to someone who is the innovation champion or who's involved in innovation within this hospital or this primary care center or this community care location? And they should really want to engage with you because they have gone through the whole innovation process education system.
Great. Now, obviously at the moment, the Health Innovation Hub is at hih.ie and at HIH Cork on Twitter. And I presume later this year, there'll be Health Innovation Ireland website? Absolutely.
So we're in the process of recruiting a director for Health Innovation Hub Ireland. Closing date, I think, is Friday. So if anyone has some wants to put in a late application, go ahead. Because we have multi-centre, multi-locations involved in this now, we're creating a new Health Innovation Hub Ireland website, and we will have staff in Cork, Galway and Dublin as well. So it'll be easier for people to access people at all locations, and irrespective of where a company is based or the actual hospital groups that are involved with us, we will endeavour to run pilots wherever it best suits the project itself. So if we have to run a project in Donegal, we can do that. If it's the right team and it's the right project setting, then we can do it anywhere in Ireland. So the aim is to be truly national, and then eventually every single hospital in Ireland will be part of this Health Innovation Hub Ireland.
Fantastic. And as the website has been launched or whatever, please let us know, and we'll certainly support that in whatever way we can.
Great.
And just kind of speaking of that, and back to the idea of the 3 Health 2 chapters in Ireland between Galway, Cork and Dublin, what can we do for you in the Health Innovation Hub and in Health Innovation Ireland to kind of help you basically develop, and obviously through that, startups and innovation in Ireland in healthcare?
Yeah, I mean, I don't know. I'm also involved in I just put myself back on the screen there. Sorry. I'm also involved in Health 2.0 Cork, and I've been up in the Galway one as well. I think that's a huge opportunity to, without being affiliated to any one organisation, but really to, one, identify bottlenecks or roadblocks that maybe companies experience in terms of delivering their technology into Ireland, and reporting back up, through the channels, whether that's done through Health Innovation Hub or independently, it doesn't matter. But really gathering the information at all sites where people, what are the barriers, what are the things that people would like to see change. I also think, proposing solutions to identify problems. Again, the people that work in the higher offices in the health service, in the government, they don't have the time to research everything or really go down to the ground level and find out what the big issues are. So I think Health 2.0 provides an opportunity to capture the information at all locations and collate it into a report that could be transmitted upwards. Okay,
great stuff. Certainly we'll keep the contact going with you along those lines. So Tanya, I'd really like to thank you on behalf of Health 2 Dublin and our membership for making your time available this evening. It's very valuable. To everybody who's online and to those who weren't able to make it, we will be creating a recording, and that will be made available through Twitter and our meetup page. And also, before we sign off, just back to our 3 health chapters. Health 2 Galway is kicking off again with a very good event on March 31st in the evening on diabetes, and there's some very good speakers, both from a startup as well as from a healthcare perspective. So Connor and Lachlan are doing really well to get that off the ground, and details are on their meetup page. And Cork recently had a very good event on disruptive healthcare, I think. Was it about a month ago, Tanya?
Yeah, and our next one is going to be focused on startups, actually, and we're not just dedicated to Cork companies. So if anybody's interested in coming down and presenting at our next meeting, which will probably be in April, just give me an email and we'd be delighted to host you at that. Just Richie, just one thing to say, Health Innovation Hub Ireland, I said it's kicking off into Health Innovation Hub Ireland, but Health Innovation Hub still is active at the moment as well. So if anybody would like to engage with us, we have 2 ways of doing it. We will be issuing calls for new innovative projects, for technologies that we can trial within hospitals and run pilots for companies. But we also operate an open door process. So if you give us a call, you can come in at any time and talk to us, and we can see how we can assist you, or even just do a basic kind of plan on how a pilot might run if you were to be successful through the call process. So I would, welcome anybody contacting us and coming down to visit us if they want to.
Absolutely. And just interestingly around that, I know Jane, one of our committee members in Health 2 Dublin, is planning a pitch night on May 4th.
Okay.
And I don't know if it's convenient for you or Coleman or any of the team, but we'll certainly keep you in the loop on that, and hopefully there can be some representation at it, you know.
That'd be great, yeah, absolutely.
That'd be great, yeah. I know it's Jane is at the early days of just planning it, but we'll keep you in the loop on that.
Okay.
Tanya, thanks again. Really very interesting. Always good to talk to you. And
very welcome.
Thank you on behalf of everybody for making your time available.
Not at all. Thanks a million. Thanks, Richie.
Cheers. Bye now.